Before I was a senator, I was a small businessman. My wife and I owned 3 shoe stores. When I was showing someone a shoe and he said he didn't like it or couldn't afford it, I didn't try another sales pitch. I knew it was time to find another shoe, one he liked and could afford. If the customer is complaining, get something else to show. Mr. President, the customers are complaining. The voices of August are still out there, and they know that this bill is just more of the same. There is a lesson in that story when it comes to reforming health care. It's time to listen to our customers and find an alternative they want and can afford. The intensity of the country's disapproval is apparent in town hall meetings, letters to newspaper editors, citizen protests and constituent calls, and letters from all across the nation. We need to enact reforms to bring down costs so everyone will have access to quality, affordable health care. We need to take a step-by-step approach to reduce health care costs and lower insurance premiums for individuals and employers. We need to eliminate discrimination based on pre-existing conditions and ensure that people can take their insurance with them from job to job. I support common-sense reforms that would achieve all these goals. Unfortunately, this 2,074-page Reid bill fails to address these issues. Instead, this bill would raise taxes by $493 billion. It would cut another $464 billion from the Medicare program. The bill would reduce wages and eliminate the jobs of millions of Americans. It would actually drive up health insurance premiums for many more Americans and still leave 24 million people without insurance coverage. We need to do better than that, and I think we can. Under this flawed bill, if you take a prescription drug, you will pay a new tax. If you use any medical devices or equipment, ranging from walkers to wheelchairs, you will pay a new tax. If you do not have health insurance, you will pay a new tax. If you do have health insurance, you will also pay a new tax. And if the government decides your health insurance is too expensive, there'll be a new tax for that just as well. The problem with our current health system is not that we don't pay enough taxes. Americans actually want to lower their health care costs. That's the message. Not just pay more taxes to the federal government. All of these taxes will only increase costs, making health care even more unaffordable. The bill mandates that insurance premiums for younger, healthier workers be tightly tied to the costs for older, sicker individuals. This will immediately drive up costs for the young, healthy individuals who coincidentally make up a significant portion of our current uninsured population. The bill also eliminates consumer choices, requiring Americans to buy richer types of plans that cover more of the deductibles and cover more out-of-pocket expenses. These plans typically have much higher premiums. The practical effect of this bill is that Washington could dictate to every single American, even those who have insurance they like now, the coverage they would need to purchase. Washington will tell you what is good enough coverage. The bill does not give people affordable options, and it penalizes those who do not purchase high-end, expensive plans, regardless of what they want, need, or can afford. I sat through the markup on the Health, Education, Labor, and Pensions bill, where virtually nothing was taken from Republican ideas, and what was changed without consulting a single senator to wind up with the bill that was actually printed. I was part of the group of 6 that ended with phony deadlines, tight timelines that kept us from getting the job done. This is so immense to change all of health care for all of America and affect 100% of the people. You can't do that even in a 2,000-page bill. And nobody can understand a 2,000-page bill, especially if it's filled with directives for the Secretary of Health and Human Services to fill in the details.